Broadcast is now starting. All attendees are in listen-only mode.
Good afternoon, everybody. This is Stephen Peters. I'm the president of the American Military Partner Association, and we are very excited to have you today joining us for our second part of our presentation on navigating your benefits for military families. And this second presentation is on healthcare, which is I know is a big deal for a lot of our families who for a long time have either gone without healthcare or paid large amounts of sums out of pocket for it. So we are very excited to be talking about this today. And we have a great panel with us. I'm going to actually let everybody briefly introduce themselves. So we'll just do a little round robin to get that started. Let's go ahead and let me make sure everybody is unmuted. Wendy, why don't you start and tell us about yourself a little bit, and then we'll move from there.
Hi, everyone. I'm Wendy Cruz. I am a special needs mom. My husband's active duty Navy, and I'm the founder of the Military Special Needs Network.
Fantastic. Thank you so much for joining us today, Wendy.
Yeah.
Thank you so much for joining us today, Wendy.
Thank you.
Okay. And then next we have Gloria Bryant.
Hi, everyone. My name is Laurie. I have been a family readiness officer for the past 17 and a half years. I was also married to a Marine who is now retired. I worked as a quality of life coordinator for Marine Corps recruiting, which has a lot of population that is not near a military installation. So we encounter different aspects of healthcare and how to access that everywhere. So I'm very happy to be here.
Thank you so much for being with us. And then we also have Alicia Hines Ward.
Hello, Stephen, and hello, everyone attending. I happen to be the 2013 Military Spouse of the Year, but my core is EFMP Special Needs. I've been a special needs advocate for a number of years, and my background comes with assisting those who are trying to get federal and local state benefits for special needs children and adults. I am the mom of three, at one point, special needs boys who are now thriving, and it's wonderful to be here, and I'm happy to help in any way that I can.
Well, thank you so much for being here. We really appreciate it. And then, of course, we also have our own Dr. Laurie Huntik. Unfortunately, she's on a computer that doesn't have a microphone, so she is joining us just by listening today. But she'll be able to type in any responses or comments that she has for us. Okay, we have a lot to cover today, so we're going to try to get started and see how quickly we can move through things so that we have enough time for questions at the end. Don't worry, though, if we don't have a lot of time at the end, we'll be able to give you options to email us your questions and we'll get them back. We'll get back to you with answers. So let's go ahead and get started with Tricare. And I'm going to share my screen to get started for those of you who are joining us on your computer. And our first discussion is going to be on Tricare. Go ahead and get this out of the way. All right. So today we're going to discuss Tricare, how to establish your eligibility and the various benefits available to you. We'll also cover other important information, including overviews of the pharmacy and dental programs. And then finally, I'll provide you with important contact information so you can get assistance and find answers to any additional questions that you may have. Tricare is the Uniformed Services Healthcare Program for active duty service members, active duty family members, National Guard and Reserve members, retirees and retiree family members, survivors, and certain former spouses worldwide. Tricare is available worldwide and managed regionally. There are 3 Tricare regions in the United States. There's Tricare West, Tricare North, Tricare South, and 1 overseas region. Your benefits are the same regardless of where you live, but you'll have different customer service contacts based upon your region. United Healthcare Military and Veterans administers the benefit in the West region. HealthNet Federal Services administers the benefit in the North region, and Humana Military administers the benefit in the South region. All three regional contractors partner with the military health system to provide you with health, medical, and administrative support, including customer service, claims processing, and authorizations for certain healthcare services. You'll need to contact information for each region, and it'll be provided at the end of this presentation. So, the Defense Enrollment Eligibility Reporting System, that is what DEERS stands for. That's a worldwide database of service members and dependents who are entitled to military benefits, including Tricare. And as I'm sure all of you have heard, no later than September 3rd, you as a legally married military spouse will be eligible to be enrolled into DEERS and gain access to Tricare. Service members or sponsors should be automatically registered in DEERS. However, sponsors must register family members in DEERS for them to be eligible for Tricare coverage. To register family members in DEERS, sponsors should visit a Uniformed Services Identification or ID card issuing facility or mail the information to the Defense Manpower Data Center. Proper documentation, such as a marriage certificate, divorce decree, birth certificate, and/or adoption papers is required. In the sponsor's absence, an individual with valid power of attorney may add family members to DEERS, and I know there's several situations for our folks that might apply to. At any time, you may verify eligibility through the web by visiting your MTF's Patient Administration Office or by contacting your service's personnel office. Anytime the sponsor status changes in DEERS, family members who are registered in DEERS will also have their eligibility changed accordingly. Remember that providers are legally permitted to copy military and dependent ID cards to verify Tricare eligibility. While only the sponsor may add or remove family members in DEERS, both the sponsor and family members age 18 and older may update contact information. Whenever there is a change in family status, such as marriage, birth, adoption, divorce, or death, DEERS must be updated. Individuals eligible for Tricare benefits include members of the Uniformed Services, that's Army, Navy, Air Force, Marine Corps, and Coast Guard. Beneficiary categories include active duty service members, active duty family members, retired service members and their family members, National Guard and Reserve members and their family members, survivors of deceased service members, certain former spouses, and other such as Medal of Honor recipients. As you can see from this slide, spouses and dependents are eligible for Tricare benefits. Unmarried children, including stepchildren, are eligible for Tricare under their sponsors until reaching the age of 21 or age 23 if enrolled in full-time course of study in an approved institution. Unmarried children who have aged out of regular Tricare coverage. Dependent parents may receive care at an MTF on a space available basis only. Eligibility for former spouses depends on the number of years of marriage during which the sponsor was on active duty. If a sponsor dies, including National Guard and Reserve members on active duty orders for more than 30 consecutive days, their surviving spouse and children remain eligible for Tricare benefits. Their surviving spouse is eligible for Tricare as long as he or she does not remarry, remains covered as an ADFM for 3 years following the sponsor's death as a transitional survivor. After 3 years, his or her status changes to retiree status with applicable deductibles and cost shares. There's also a little bit of information there for surviving children. Tricare Prime offers comprehensive healthcare in specific geographic areas called Prime Service Areas, or PSAs. PSAs are areas near military treatment facilities, and other areas where regional contractors have established Tricare Prime networks. Beneficiaries eligible for Tricare Prime include ADSMs and their family members, retired service members and their family members, survivors, certain former spouses, and others such as Medal of Honor recipients. With Tricare Prime, you will have a primary care manager or PCM. And as we go through this, I want to point out that no one Tricare plan is perfect for everyone. And there's actually a great, right?
Great call.
There's actually a great tool on the Tricare website that gives you options to compare plans that you'll definitely want to check out. Tricare, I'm sorry, let me go to this next one. I'm going to scroll through a few of these. Just give me 1 second. So just going to discuss briefly priority for access to military treatment facility care. Military treatment facilities, or MTFs, grant access to care on a space available basis. Your priority for care at an MTF is determined by your beneficiary category and Tricare program option. ADSMs and National Guard and Reserve members on active duty for more than 30 consecutive days always have first priority for care at an MTF. ADFMs enrolled in Tricare Prime will have second priority, and space is limited for family members covered by Tricare Standard and Tricare Extra. National Guard and Reserve members, retired service members, and their family members not enrolled in Tricare Prime, TRS, or TRR are granted access on a space available basis, and space can be very limited. The Tricare Pharmacy program is a benefit available to you regardless of which Tricare program option you choose, unless you're enrolled in the U.S. Family Health Plan. To fill a prescription, you'll need the prescription, a valid Uniform Services ID card, and up-to-date information in DEERS. I'm not going to read through all of these slides, but they will be available afterwards, so you can go back and reference these for more information. I'm going to go down here to this information page. This slide shows contact information for stateside and overseas regional contractors, as well as other important information sources. Remember, your regional contractor is based on where you live. And just want to reemphasize that these slides will be available to you afterwards on our website. So I will make sure and post those there, as well as the private group, so you can go back and reference these slides. So now we're going to briefly talk about the Exceptional Family Member Program, which we are very excited to have a few experts here to talk about. Let me go ahead and get that slide open for you. And you can just go ahead and take off when you are ready, and I will change the slides for you as you go through.
Thank you so much, Stephen. I really appreciate it. I also want to make sure that you also take a look at that Tricare Dental option. That is something that I would caution you to be extra careful about. Spouses and family members are limited to a nominal amount per year for dental benefits, so please don't assume that the benefit that's extended to the active duty service member is the same benefit that is extended to you. So I just wanted to throw that out there. Next slide, Stephen. Okay, I'm going to talk to you a little bit about the EFMP program, which is the Exceptional Family Member Program. It is the prong that the Department of Defense extends to those of us with special needs family members who face particular challenges. This benefit is available to children, spouses, and in some branches of the military, elderly parents, provided those parents fall under the dependent guidelines. There are 3 prongs to the Exceptional Family Member Program, and I'll be very brief with it. The first one is the identification and enrollment. The slides will be available after. I tend not to PowerPoint you to death, so I will probably do more talking than slide reading. But the first important thing is that if you have a family member that's identified with a special need, whether it's medical or educational, and medical could be anything from asthma to a severe or debilitating condition, or an or an educational challenge such as, dyslexia or something like that, those needs have to be documented through the program. Now, the DD 2792, which all branches use, is the form that identifies and categorizes the medical condition. The DD 2792-1 is the one that determines the education challenges, and if there are any children who have an IFSP or an IEP, that would be the form that would actually activate those early intervention benefits, really. And these are all completed by your PCM, which is your primary care manager, or your medical provider if you use a United Healthcare plan that is outside of the Tricare network. I can say in the Air Force, which is where I'm most familiar, you are then Q-coded and identified once that process is complete. Next slide, Stephen. Thank you. Now, although this process differs, there are some commonalities. Everybody uses these same 2 forms. All of them are submitted to the receiving location for review, and basically there has to be a determination whether the care is substantiated or if it's even available. Now, all of these forms are completely confidential. On the bottom of this slide, you'll see for the different branches who your personnel would be to help you complete these forms or answer any questions if you're with the Army, Marine Corps, Navy, or Air Force. The Air Force has 2 different prongs here. There's a family support coordinator, and then there's a medical coordinator. That medical coordinator is the one who actually gets the ball rolling for you. Next slide, please. Okay, the second prong is the assignment coordination. Now, we PCS a lot. That's just the nature of our lives. However, typically, when you have an exceptional needs family member, your support resources and your care are where you are. Now, before you can PCS in any branch, we have to ensure that where you're going to can adequately care for your family's needs. Now, what happens is that medical personnel then will review the medical records, speak with the doctors, and make sure that your gaining facility has the capability to take care of your requirements. If that gaining facility cannot care for those requirements, guess what? You don't get to go. Sorry about that. Next slide, please. Thanks so much. Now, the third prong is the family support, and that's really a very important part of it that I'm sure Wendy will go ahead and give you more specifics about, but really is what's absolutely necessary to support you through these challenges. Now, the point of this is to provide access, resources, and services. And those services may be available within the Department of Defense, within your branch, or within your local community. And so this family support will give you information within your surrounding communities as you PCS in or PCS out, give you relocation assistance, do that warm handoff so that you're not left in the weeds somewhere because you're going into a new location and you know no one there. They help you with financial management. So, for example, if you have a need for additional medical support apparatus that may not be supported through the ECHO side of Tricare, which is its own separate seminar, they can direct you to those resources to help you with early intervention services in your local schools, case management, education, and of course respite care. And respite care is available in all branches, but with different requirements and different hours. I won't go into that at this point. That will take us all afternoon. Next slide, please. Okay, now the requirements for the Efmp are quite simple, and I'll say currently all Title 10, and that means active duty members regardless of the branch are required to enroll in the Efmp service. once they're identified as having an exceptional needs family member. Now, the National Guard's a little bit different. On the air side, it's not required enrollment, but on the Army side, there is. However, once any National Guard member becomes activated, they then fall into that Title 10 category, and that mandatory requirement kicks in. Next slide, please. Okay, this slide is just going to give you a couple of resources, and this does say Maryland Disability Law Center because I'm here in the National Capital Region. However, Military Homefront, Military One Source, and there is an Efmp app that you can use. That link is actually live on the bottom of that page that will help you locate your medical treatment facilities, help you locate your Efmp support, and this app actually will give you global information to support you. This actually concludes my part of the Efmp presentation. Does anyone have any questions, or are we opening the floor for those?
Let's go ahead and let Wendy jump in with her part, and then at the end
Roger
we'll
that.
go to the questions, just so we make sure we get to the whole presentation. So Wendy,
Great.
I'm going to unmute you.
Okay. Yay.
In just 1 second, I will have your presentation here. All right, you are good to go.
Okay, well, again, thank you so much for having me on. Now, we've got EFM families have a lot of different struggles than your typical military family. And one of the biggest struggles that we face is PCSing to a new duty station. Now, prior to moving, our EFM families have got to consider some of the following. What is the availability of medical care and therapies for our child? Are there local and state resources that we qualify for? What about schools? Are they available for special needs? Is there ADA housing available? What's the traffic like from home to medical centers? What about the cost of living, especially if you have to rely on one income? Is there family support locally, or are there others there that can help out? And can someone make recommendations for doctors and therapists and programs? And then what is the wait list for respite care? And like Alicia said, we could spend some time talking about child care and respite care. Next slide, please. PCSing is one of the most difficult challenges we face, but once we arrive at our new duty station, we've got to climb a mountain and establish services for our exceptional family member before we can even begin to adjust. The first thing that we need to do is enroll in the Tricare region. It seems very, very simple, but if you're moving from coast to coast, it can be pretty challenging. Next, you've got to request your medical records to be transferred. Now, this sometimes can take 30 to 45 days, and when you have a child with special needs, this is precious time. You've got to make an appointment with general peds to establish care and have them start on a referral process if you need specialists or therapies. You've got to wait for Tricare to process and approve or disapprove referrals, which can take a couple of weeks. In the meantime, you've got to make an appointment with these specialists and with your EFMP liaison so they can help identify community supports. When the referrals are processed, you've got to schedule appointments. There are probable wait lists. At night, we're researching and identifying programs that are available, making appointments with schools for IEP meetings, and you need to try to establish an emergency child care plan, because most of the time specialists, they won't accept siblings that come along. This process typically takes 6 to 8 months to establish. Oh, and as a side note, this mountain is for our exceptional family member only. It doesn't account for siblings. That's another mountain to climb. Next slide. We do face some common struggles. I'm not going to go into a whole lot of them, but some of the commonalities that we face is navigating complex systems. Most big military installations are saturated with fellow EFM families, and this can cause the lack of availability of providers and wait lists. give you a little example, I live in San Diego, and there are 5,500 EFM families here, and wait lists for providers can be very lengthy, and both in military and out in the community. Local and state services. Medical waivers exist in all 50 states, but again, there's wait lists and lots of paperwork, and there can be parent income requirements and restrictions. The third feeling, we feel isolated. Most of us are stationed far away from our extended families. There is typically a wait list for child care or respite care, and that can also be pretty isolating. Most of us also have our typical siblings, and we get to drag them to all of our appointments, but still trying to find that balance to meet their needs for support as well. Now, the military life creates a self-reliance just by our culture, but it also attributes to our isolation. We're used to picking up and going, and it's really hard to lean on others for support. Next slide. That's my daughter, by the way. No matter the challenges that we face, a support system must be established and maintained for our families to grow and thrive. Next slide. This is a big one, but an effective support system encompasses all of the areas that pertain to our exceptional family member. It includes medical and specialists and therapies and child care and EFM support and all areas that you need to build an effective support system. It is just really imperative to sit down and identify your support network and put together something like this so that you can see what you need to put together to build a good system for you. Next slide. Now, families, they deserve to have the support to help them along the way. From diagnoses and milestones, regressions, achievements, our families deserve to have friendships with other special needs military families that have been down that road and can offer advice and mentorship. And that's how the Military Special Needs Network was born. We created our sites to hopes that families could connect and share information and empower each other regardless of disability, branch of service, or location. We are global. We've got currently over 2,200 members. We've got some amazing programs and services that we offer to really help support and celebrate our special families and empower each other to be the best advocate for our family, our community, and the military. We are all here to support and empower each other, and most important, to celebrate the fact that we're not families with special needs, but we're a special community of awesome military families. If you have any questions, concerns, my email address, I can definitely make that available, my phone. Call me. I'll be more than happy to help with anything that you might need.
Fantastic.
Thank you so much for having me.
Thank you so much for being here. We really appreciate it. Gloria, are you still with us?
I am.
Great. I was hoping that obviously access to the Tricare and healthcare system is through enrollment in DEERS. And I was wondering if you would briefly just discuss with our folks that process of how they go about getting enrolled.
Sure. If there's nothing else that I want you to take away about the enrollment in DEERS, is that is what is going to unlock all of the benefits that you are eligible for. That military ID card is going to make you eligible for Tricare Benefits if that is what you are entitled for. That's going to give you access to any services that are available at an installation. It's going to give you access to commissaries, exchanges, space available, travel, anything that is related to the life of a military family. That ID card is going to show everyone that you have access to those benefits. The first thing that you need to do is enroll. Many installations will have an ID card office. If you are not near a military installation, reserve units will have the availability to help you get an ID card. There is a form. The Marine Corps and every single one of the branches will have the same exact form as the DD form 1171. That form is going to contain your sponsor's information, and it will contain your information if you have a spouse and any children that need to be enrolled in DEERS. You will also have to have supporting documentation to show that you are an eligible person to be enrolled in DEERS. Your sponsor will have to be there. You will have to have a marriage certificate, birth certificate. I would encourage you to bring your driver's license just in case they need. Each one of the offices may ask you for something a little bit different, but birth certificate, marriage certificate will be important for you to bring along. Once you have that military ID card, then you will be in the DEERS database. Once you have that ID card, you will be able to enroll in Tricare, either Tricare Prime. That ID card, once you are in the DEERS database, will automatically enroll you in what is called Tricare Standard, which is like a fee-for-option program. The only of the 3 Tricare programs offered through Tricare that requires an active enrollment will be the Tricare Prime option. But the moment that you obtain an ID card, that automatically enrolls you or gives you the option and access to Tricare Standard and Tricare Extra. You will get an ID card that for you as the spouse of a service member will have to be renewed every 4 years. If your sponsor is not available, then there is a way of you obtaining that military ID card renewed. You must have a power of attorney. You will have to have that 1171 notarized by his admin unit, or if you have a power of attorney, you will be able to go with that. But that ID card needs to be up to date and do not allow it to expire, because when there is a break in eligibility, that is going to affect your Tricare eligibility as well. Both of them go hand in hand. Very, very important. A lot of people don't understand that a military ID card and access to benefits in the Tricare service are together. I think that is the basic thing. Every single one of the major units will have an ID card. There is an app that you can actually download to find the records offices, and that means that they will be able to assist you in enrolling in the enrollment in the DEERS program.
Fantastic. Thank you so much. I really appreciate that.
No problem.
So I think we will go to questions now. We still have, looks like, a few minutes we can get some questions in. For those of you who are listening in, there's the option to type in your question in the GoToWebinar option there. There's also the ability to raise your hand for a question as well. Let me go to there and see what our questions are. I did also want to emphasize one more time, Dr. Laurie Huntik wanted to make sure that we emphasize that there is not a one-size-fits-all approach about these insurance options, and that she is available to you to answer any questions that you might have. So I highly encourage you to reach out to her. You can reach her at Laurie@militarypartners.org if you do have any questions. Okay, it looks like our first question is from Ashley Broadway, and she says, we have an AMPA member that has a son that is presently in the Efmp program. He is making amazing progress. The family just received orders to PCS. The family is afraid that all of his progress may be lost because he trusts his counselor therapists. Is there anything this family can do to try and stay at their current location? And I'll let any of you jump in that thinks might be best to be able to answer that.
I'll jump in. You know, there are a couple of things. The EFMP program is designed to protect the family, to make sure that the family can receive adequate resources, medical information, medical, educational, in where they're located at. It does not mean that the service member will not be deployed or moved. So there are a couple of things. The family can, of course, make sure that the incoming duty station can provide this, the same similar resources for the family, and the current providers can start easily preparing them for the move. There's always going to be a level of regression, always. Trying to minimize that and open up the doors for the new place. They can always try and stay at their current location. There's many doors that they can look into.
That's correct, and I'll also jump in there. If the family sincerely believes that PCSing to a new location will cause severe regression, they do have the ability to go back to their EFMP medical support and let them know, have them reevaluate and speak with the medical personnel, and it could very well be that those orders will be rescinded. You'll find in some cases, depending on the severity of the challenges that the family members face, that to protect the child, depending on the mission, because of course everything is always dependent on the mission, that it may be more worthwhile to actually leave that service member and the family at that current location. So there are some resources available. Nothing's guaranteed, of course, but this is where you can actually get those care providers involved, and they can write letters and they can go ahead and support whether they believe that the regression that will happen, because it happens to all of them, as Wendy says, would be to the detriment of the child.
Great. Thank you so much.
I'm going to just jump right here as well. It's important for you to communicate with the EFMP manager. They have the ability to assist you and be your voice. If there is a true reason, if it's something that is going to affect the readiness of your family and the ability to be healthy, they can, as well as your medical staff, be a great voice to you as a family. Utilize those resources because they are there for a reason.
Great, thank you. And it looks like our next question is from Rose Holland. She asks, do activated reserve and guard families qualify for EFMP services? I know they did not at one time.
They do.
Great.
Short answer, they do. And I'm saying this as a guard spouse as well. But it also depends on the branch. If they're Army, then those benefits are automatic. If they're Air, you have to ensure that when activated, that they inform their intake that they do have an exceptional needs family member, because that data is not kept and it's not stored every time they activate. That information has to be repeated so that part of the family care plan or part of those support services through Yellow Ribbon can go ahead and be activated. But yes, once they transition from Title 32 into Title 10, those EFMP benefits are available.
Great, thank you. Next question is from Nisa, and I apologize if I say your name incorrectly. She says, my son has ADHD and has a 504 plan at school. Does that fit under special needs? Also, my kids and I recently moved to be in the same state as my wife, and we have no medical coverage as yet. I had to pay out of pocket for his medication because of no coverage. Does the medical provide back pay for services we paid out of pocket prior to September 3rd, or do we just eat up that cost?
Gloria? There's a couple of questions in there, and one of them is whether the ADHD is a qualifying condition. In most branches, the short answer is yes. Having a 504 plan will allow you to have some support through the EFMP Family Support Coordinator. Whether having to pay out of pocket for those that insurance and those benefits. I'm so sorry you had to do that. Whether that would be retroactive is not a question that I'm sure we can answer at this point.
Great, thank you. Wendy, I had you muted, so I'm going to unmute you just in case you had anything to add.
Oh, same as Gloria said. Definitely the disability would qualify you for supports. Again, the best bet is for the family to seek out to their exceptional family member liaison or program manager to discuss that.
Great, thank you. All right, our next question is from Mel Sweeting. What are the differences in the Tricare options?
Let me go ahead and jump on that one. There's three prongs. Is Tricare Standard, Tricare Extra, and Tricare Prime. The moment that you are enrolled in the years and you possess the military ID card, you will have access to Tricare Standard and Tricare Extra. These are fee-for options, medical care, where you will have a deductible and you will have a cost share. Depending on the rank of the sponsor, that's how they structure their annual deductibles. Tricare Prime is very similar to an HMO. You will not have a deductible, but you will have to pay a copayment every time you go and see your primary care physician, which is the key to the key difference between the standard and option. You will have to see your primary care manager before you see a specialist. In the case of someone that has an exceptional family member in family, it depends on the flexibility that you're looking for, the program that is best suited for you. There are some families that will have that exceptional family member in standard because it gives them the flexibility to go and see specialists that they need to see. And they have other family members in Prime. The best way for you to decide which option is best for your family is to get to know Tricare. Tricare is complex, but it's a very, very comprehensive program if you know how to navigate through it. There's lots of information on the website. The contractor sometimes will be able to assist you with specific questions that are related to your family. But those are the three basic options for Tricare. Standard, Extra is the same as Standard, except that if you use a network provider, you can save a little bit of money on your cost shares and when you go and see a physician that is in the Tricare network. But that gives you that flexibility as well with a bit of a savings. And then the Tricare Prime that you must enroll in order for you to be eligible for it.
Great, thank you. And I'll remind everybody again that the Tricare website does have a comparison tool that I encourage you all to check out. Our next question is from Monica Waluza, and she says, will these spousal benefits continue after the service member retires?
Yes.
Simple enough.
That's a short answer. Short answer, yes. Those benefits will continue. There may be some changes depending on what options the member chooses at the time of retirement, if the transition program still exists at that point. But yes, those benefits will continue. And the other thing that I wanted to bring up also, when you made your presentation about Tricare, that those benefits are available for some military spouses. Those spouses that those benefits are available for typically are members, spouses who have fallen into certain categories where there was some violence or something like that. So there are some extenuating circumstances where those benefits may still be available after the spouse may no longer be married to the military member.
Great,
but Gloria will probably have some more information on that as well, but those are extenuating circumstances.
Gloria, did you have anything to add?
No, it's correct. Especially if you have any type of abuse in the family, in that specific spouse has been as a victim of abuse, there is programs and there is certain conditions that if they need them, they will be eligible for services after the service member is no longer their sponsor. Retirement.
Right.
The major difference when it comes to retirement is going to be the fees. When your sponsor retires, then if you want to continue in, accessing Tricare Prime, you have to re-enroll in Tricare Prime because now you have to pay to have that access to Tricare Prime. The fees are very, 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 very. They're great in comparison to civilian healthcare, although with the changes that are taking place right now, we may see a little bit of a hike. But they're very competitive if you look at the cost of civilian healthcare out there. But there is a change, and then again, even if you are enrolled in Prime, as when your husband is or your partner is enrolling in Tricare Prime and you're active duty, you still have to re-enroll in Tricare Prime to have the access to that benefit as well.
Great, thank you. Our next question is from Arkishia Brown. She says, my partner and I are in different locations. I am the military member and am in San Antonio, and she and our daughter are in Georgia. What would be the necessary procedures to have them receive their ID cards for their enrollment of DEERS and begin using Tricare Benefits? I do know she is close to a military installation. Would they be able to go to that military installation and to enroll without me necessarily being there?
I'm going to jump on that one as well. There's a couple of things that you can do. You can go to your admin office, get them to give you an 1171. Someone can notarize your signature, and you can put that in the mail. Your partner could go to that ID card office in Georgia and present that 1171 along with birth certificate, marriage certificate, etc., and an ID card. That is probably the easiest way that I can think of that you can get that to her. Or if she has a power of attorney, some military ID cards will allow you to do those things with just the power of attorney. But to be on the safe side, I would do the 1171, get it notarized, and get it in the mail.
Okay, great, thank you.
Yes.
Do you have anything to add or no?
Actually, no. That's absolutely perfect information.
Great. Next question is from Christy Rousey. My wife is A&G and is going on a prolonged active duty tour next month, so our son will go under Tricare. He has some recently diagnosed medical issues that are likely to require serious surgery. We are in the middle of this process and don't want to start over with an MTF provider. Can we continue with his treatment, etc., or do we have to start over?
That's a challenging question. I'll jump in on this one. Being Air National Guard spouse myself, it depends on it basically depends on your insurance. If you choose to pick this up at this point, then Tricare will take it over. You can use Tricare as a secondary and maintain your primary if you have other insurance, but it depends on how he is covered right now. That'll actually determine whether you have to start over or not, unfortunately.
Okay, thank you. And Wendy, I'm going to unmute you just in case you had anything to add there. Wendy, did you have anything to add?
And just like Alicia said, this is going to be a very challenging case. But again, if your primary insurance, you can add Tricare as a secondary insurance to maintain current benefits.
Thank you.
Yes, but if you do maintain your current benefits, just remember that you will be paying out of pocket for that.
Okay, our next question.
If you're using Tricare as a secondary. Okay.
Thank you. Our next question is from Corinne Eves. She says, for EMFP members, can you hand carry your records from one duty station to another? Also, do you have the option in obtaining copies of medical records prior to move in case records get lost? so you can give a copy to civilian provider in case there isn't availability on base?
You always have the right to have a copy of your medical records, but you do have to request it. It's one of those things that we advise as well, that you maintain a copy of your medical records. Some states actually will destroy those records after 10 years. So it is always best that you have a copy of those medical records, whether EFMP or not. As far as hand carrying them, some facilities will not accept hand carried records if they are completely electronic, but for your personal purposes, that's always the best and most prudent course of action. As far as the continuity of benefits goes, there really should be no change if you're already identified. Just before you leave, just try to contact, and all of the branches actually have this information available online and also through the Efmp app that we talked about before, to make a warm contact with your gaining installation, just to ensure that they do have that record that you're coming, and that you can start that warm fuzzy feeling before you actually leave your losing installation.
Great, thank you. So we're starting to run out of time, so I'm going to try to go through these questions a little bit faster. And again, if we don't get to your question today, do email us at partners@militarypartners.org with your question, and we will do our best to get it answered for you. Next question is from Tatiana Farrell. She apologizes that she came in late, but my question was, I have special needs siblings, and I will be their caretaker if anything happens to my dad. Will Tricare cover them as well if I had to take on guardianship?
I'm going to jump
Laurie,
on
you want to
that one
grab that?
just a little bit. Yep.
Okay.
Eligibility, again. Eligibility to services depends on the DEER's enrollment. If you have legal guardianship of a sibling, it will be determined based on that. It's very, very, I used to get a lot of questions about parents in the same category. They may have access to health care if you are close to a military facility on a space available basis, or if you have legal guardianship, there may be other restrictions. So just because you have legal guardianship, that doesn't necessarily mean that they will have access to the full benefits that you may have. And again, if they're not eligible to be enrolled in DEERS, then they will not have access to any benefits that are normally, available to everyone else.
Thank you. Next question is from Anissa. She says, does the whole family have to be on the same type of Tricare plan as the sponsor?
No.
Yes. No. Well, it depends. But short answer, I think, is no.
Okay.
Gloria?
Yes.
You want to?
I agree. As I mentioned earlier, I may have a family member that, because of their care, because of medical necessity, and that is a huge key thing that you need to keep in mind. Everything that is done under Tricare is based on medical necessity. So if you have a real reason why you or a family member must be enrolled in standard because you have the availability to go to, the doctor that person has been seeing for the past 5 years. Again, if there is a medical necessity, if there's availability, then there is options for you to have that specific family member enrolled in one, and then the rest of the family enrolled in something else. Again, everything is going to be based on medical necessity and DEERS enrollment eligibility.
Great, thank you. We're a little bit over time, but I'm going to try to get in a few of these questions real quickly. Next question is from Ron Gattengay. He says, my husband is a veteran who was medically discharged and receives health care through the VA. Would he have to give up his VA health care if I enroll him in Tricare Prime?
That's a good question.
It is a good question, but for what I know of it, the answer to that is no.
No. Right.
And I only can answer that part of it because of my familiarity with the transition assistance program. Those VA benefits are his entitlement because of his service. Tricare would, of course, probably fall to the secondary insurance if
Right.
most of his treatment is done through the VA, but Tricare would be a secondary. Tricare would not be primary. His VA benefits would take precedence.
Okay.
Right. And it would have to, again, we would have to know a little bit more about the service member, what the status of that service member is. So there, you know, he can probably use Tricare as a secondary payer.
Yeah. But that's if a secondary payer is required. But of course, everything is a case-by-case basis. There is no cookie cutter, cut and dry response to anyone's particular circumstance.
Great. Thank you. Just a couple more questions and then we'll wrap up. Christina Robertson asks, is there any timeline for VA benefits such as home loans and GI Bill transfer? And Christina, I can go ahead and answer that for you. We're still waiting to hear from the Department of Veterans Affairs on how they are handling the Supreme Court's decision in regards to benefits for same-sex spouses. There's a little bit different issues involved because of different statutory restrictions that they fall under that the Department of Defense does not. And they are in the process of working that out with the Department of Justice. But again, we have not received a timeline on that yet, and we hope to hear something soon. And believe me, as soon as we hear something, we will make sure to get that out to you. I think our last question is, are there any educational benefits for spouses? And that's from Mel Sweeting. And actually, Mel, that's a great transition for us because in 2 weeks is the third part of our webinar series, and that is going to be on education. Oh, I'm sorry. The next one is on employment. Our first one was on education. So if you go to our website, I will make sure and post the link in our private support network to our past webinar that you'll be able to listen to the presentation as well as see the slides on education benefits. Our next presentation in 2 weeks is on employment, and then 2 weeks after that is financial services. So we hope that you all will join us for those as well. The registration for the next 2 webinars are not open yet. However, as soon as it is open, we will post that in our private support network as well as via our social media. So keep an eye out for that. I want to thank you all so much for joining us. This presentation will be available on our website afterwards, along with all the slides that you saw today. So I hope you'll go and check those out if you missed anything. I want to thank our panel for joining us. It really means a lot to us that you were with us today to answer our questions and give us insight. And I'll just give you the panel one last opportunity to say anything if they needed to add anything.
Okay, I guess I'll go first. I just wanted to say that, you know, it is absolutely wonderful that we're finally getting to this point where you are being completely included in a place where the other spouses are. It's been a tough road, but there's tougher roads ahead, and just know that there's so many of us behind you and supporting you, ensuring that you get your true entitlements. And I will make myself available, Stephen, for any further questions that you have. I am a National Guard spouse, of course, and I am an EFMP special needs advocate here in the National Capital Region. So if there's anything that I can do to help you or any of your families, Stephen knows how to get a hold of you. Very many of you also know how to get a hold of me as well. Feel free to tap me. I'll do whatever I can to help. And thank you so much for this opportunity to be able to share a little bit of what rattles around in my head with you.
Thank you so much, and we really appreciate you joining us. Wendy, did you have any saved rounds for us?
Well, again, I'm so excited about the wonderful changes that are happening. I'm here for you 24 hours a day. We do have a 24-hour-a-day support group. If there's anything that I can help, questions, help point you in the right direction, please contact me anytime, day or night. I'll be here for you.
Thank you so much, Wendy. We really appreciate it. And then Gloria, any saved rounds from you?
Again, I am going to follow with everyone else's. I am excited about these changes. I think that this is something that I'd always thought that we needed, And finally, I'm seeing the changes take place. I am available as well. Stephen knows how to get hold of me. If you have a specific question, let me know. I still have lots of connections in the military community, and if I don't have the answer, we will research it and find it and send it to you. So I'm very excited to be part of this. This is wonderful. Thank you so much for inviting me.
Great, thank you, and thank you all again so much. All right, well, we hope you all will join us next time. And again, if you have any questions, make sure to email us at partners@militarypartners.org. Thanks so much, you all. Bye-bye.
Thank you. Bye-bye.
Bye-bye.